Hey, what's going on, guys? Rich here at CPAP Corner at Foot It Medical. I'm going to give you a few tips and tricks on how to get used to your CPAP equipment. The national average is only 50%. 50% of you guys will fail, will give up, and stop using your equipment. Where now you'll be at higher risk for heart attack, stroke, Alzheimer's, dementia, anxiety, depression, certain cancers. The list goes on and on and on and on. So it's very important for you to stick with your CPAP equipment, and I'm going to give you some tips and tricks that I've used, that I give to my patients, and hopefully it'll help you guys. So first and foremost, when you go to your sleep study and you get diagnosed with sleep apnea, you have to be your own advocate. You have to do the research in finding a good CPAP supplier. Most of the CPAP suppliers out there have remote offices. They have remote offices with no equipment on site. It's appointment only. And it's very difficult for you to get help you want, because when you call a number, you're usually calling an 800 number that's either going overseas or going through essential headquarters. So that's first and foremost. Do your research. Number two, understand that it's an imperfect system, that this machine is going to make noise, it's going to blow pressure at you, the masks aren't going to be 100% comfortable, and you're not going to find a perfect system. You're going to have to get used to it. A typical user might take 4 weeks or longer to get used to it. I often tell patients, it often gets worse before it gets better. You may have the worst night's sleep for a few weeks and say, this is awful, but stick with it. Use times and work your way up. So for the first night, if you only do a half hour, try to do an hour and a half the next night, maybe an hour and 45 minutes the following night, so forth and so on. When it comes to masks, this is the big controversial issue, and I get a lot of heat for this. I hate suppliers who put 100 masks on a table and tell you guys, try these on to see what's most comfortable for you. That's garbage. To me, that's absolute garbage. I know from somebody coming in, measuring them, what mask they'll probably fit into, and maybe a 3% defect rate where the person comes back and says the mask was terrible, can you set me up with something else? All of a sudden, you got 50 masks, you're going to second guess yourself. Harvard Business Review did a study when they used jeans and jams. They did 60 different varieties of jeans, they did like 12 different versions of jams, and they took another supplier who had 3 pairs of jeans, three sets of jams, and people were more content, more apt to buy, and more happy with their purchase when they had fewer choices. Not only that, if you're going to a reputable place with an experienced therapist, you're going to know what's fitting for most people out there, and they'll be able to advise you. I mean, there are great masks out there, but there are crappy masks as well. And the other thing too is when you go to a supplier that has all these masks there, did you know that hundreds of patients probably use those masks before you? Were they wiped down effectively? Were they sanitized? That's a question you may want to ask if you ever come across that. The other thing too is it's common, or it was common, for unlicensed therapists to set patients up with CPAP equipment. Does it still go on today? Probably. So it's important for you, when you do get set up, ask your provider, whoever's setting you up, are you a licensed respiratory therapist? If they're not, they're doing an illegal setup. Comes to equipment, guys, there are 3 big names. This is my opinion only, and I don't mean to throw any of the other manufacturers under the bus, but if you're not using ResMed, if you're not using Philips Respironics, and if you're not using Fisher & Paykel, request those masks to be used. Those are the best masks that I've ever seen in the entire world, and make sure that you're getting it set up on newer versions of those masks. There's hundreds of different versions of those masks, but make sure they're newer versions, the ones that have come out in the last 2 years. For the first night, I often tell people, whatever their pre-bed ritual is, whether they watch TV, they're on their phone, they read, put the mask on, put the pressure on, wear it for a half hour, wear it for 45 minutes. Because so many people I see set up, as soon as you put that mask on, they're like, all they're thinking about is they're breathing in and out. That is very common, and one of the aspects of doing what I'm telling you to do is to subconsciously Forget about your breathing. Get involved in something where it becomes comfortable. So when you go to bed that night, you're somewhat used to it. It's a pretty good tip that's worked for a lot of people here. Ask your potential CPAP supplier what their compliance rate is. The national average is 50%. I can tell you firsthand, a good supplier will have 65 to 80% success rates with their patients. Give up. The most important thing is not to give up. So many people that we set up will come a day or 2 days later and say, you know what, there's no way. Here's the machine. I can't get used to this. That's so ridiculous when I see that. I just want to strangle these people. Never had anybody who come in and said, hey Rich, I've used this every day for 4 weeks. I've used this every day for 2 months. I'm returning the machine. It sucks. That's never happened. Another tip for me, which is typical if you wear a full face mask, you may get breakdown at the bridge of the nose. So I've actually found a hybrid mask that works for me. So I go in between masks. So it's okay to have maybe 2 or 3 different style masks that you go in between. I've always done that. I've never relied on one mask throughout the entire long run. Like the therapist that's setting you up and you're having a hard time with your CPAP, make sure you ask for another respiratory therapist to help you out. It's important that you trust the provider that's going to be helping you, coaching you, and advising you. Do you think I missed anything? I probably did. Put them in the comment section so the people watching this video can read them, and I will interact with you guys. And hey, sleep well.